Welcome back to the Take Control of Your Life podcast. This week, I have a very special guest. One of my best friends, Dr. Cisco Franuti. And before we get into the podcast, I'll give everyone a little bit of a background.
Sure.
Cisco and I met in 2016. I believe we met before I moved to North Carolina. I think I'd gotten back from my road trip.
Yes.
And didn't really like you whenever I first met you.
Yep.
It was like, hey, here's this guy who used to train with us all the time. And going forward, you and I had very different jiu-jitsu styles. And so we ended up having some of the toughest roles and just became best friends. And we're two very different people. But you moved to Georgia a couple years ago to start your residency, and we still talk once or twice a month. And I've picked up so much from you as far as not medical advice, but what would be the word? Just I'll call you sometimes. I might have an athlete who's struggling with something, and you'll be able to break it down for me, so I have a better understanding of how to help them. And so the reason I asked you to do this podcast, you were in last Friday. I came down to see you, and we were talking about the Ozempic shot, and we were talking about type 2 diabetes and type 3 diabetes. And you were talking about some things that was so far over my head, but you were able to break it down to where I had a better understanding moving forward of how to help my members. And so, real quick, if you could give everyone a background of where you're at in your medical journey, what you currently do in the medical field, and then we'll dive into diabetes, insulin responses, and the different medications we see and when they're beneficial.
Sure. Okay, so currently I'm starting the third year of my family medicine residency. And I used to think family medicine was just like outpatient, but that's actually, we manage patients outpatient in the clinic. We also manage patients, like we admit and manage patients in the hospital. That's another big part of our scope. We also see patients in the emergency department. We also do obstetrics rotations where we deliver babies. We also do gynecology rotations where we do pap smears and do women's health. And then we do pediatric inpatient, that's taking care of kids in the hospital, and then pediatric outpatient, that's seeing kids at a pediatrician's clinic. So yeah, we see
Do a little bit of everything.
Yeah, and I always say like we're like quarterbacks of the medical world. We can kind of, quarterback can block, they can run the ball, they can throw, they can. A lot of times, quarterback's the guy that takes the long snap and holds for the kickers, and you also coordinate. So we coordinate specialist appointments. We try to manage as far as we can within the scope of our practice. And then when we feel like, and that's up to us to recognize I'm out of my scope, that's when we refer to specialists. You don't just, somebody comes in, hey, I've been getting headaches, and then you just send a neurologist just because that's the easy thing. I guess some people might do that, but we don't do that. I don't.
So you were talking to me about some of the side effects you've seen from these Ozempic shots. And before we get into that, I want to talk about, because I was talking to you on the phone last night and you were explaining to me what insulin truly does and why people become resistant to it. And so can you break it down on like a third grade level of what's going on when we intake glucose? What is that insulin response? And then why do people become insulin resistant?
Sure. So basically, like, first thing, insulin and glucagon are like opposites. Insulin tells your body, quit burning your fuel, it's time to store fuel. Whereas glucagon says, liberate fuel, we need to burn fuel. So anytime you have elevated insulin, your body cannot burn body fat, plain and simple. Your body will store fat. It will store the glucose into cells, and then typically, like you'll have glycogen. That is when glucose gets stored in an organ. That can be in an organ, I'm saying like muscle, liver, even kidneys. And so, yeah, stored glucose becomes glycogen. And so insulin says, let's store glycogen, but then you hit a threshold and there's no more room to store glycogen. That's when the insulin directs, instead of going to glycogen, then it becomes fat. And then glucagon, like I said, does the opposite. It breaks glycogen down into glucose, liberates that into our system. Or, and then we also have, of course, my favorite, which is beta oxidation, which is when you run out of all the glucose stores, and that's whenever you start breaking down body fat into ketones.
I should have started the podcast with you've been keto for what, a decade now?
Yep. 10 years, man. Have not, I broke it one time when my mom guilted me when she made me my favorite Christmas cookies. Have not broke it one other day,
And
period.
that was what? I mean, that was years ago.
Uh,
I can remember when that happened. I don't think you had started your residency yet.
no. And that was like the first year that I ever started keto. And giving you credit, you're the person that introduced me to keto.
Well, do you remember it was when it became a fad, and I was like, "Hey, I'm trying this thing." Colin was doing it,
Yeah.
and I remember you saying like, "Nah, you got to have carb. You got to have
Yeah.
glucose."
Yeah.
And so, what was it that from your research? Because you're the guy that like you will go in, you will do the research, you have the medical knowledge to do this. What was it in your study of keto that made you realize like this is one of the best things that someone can do?
So first off, I went in with all these expectations that you might hear from like a lot of docs that, oh, that's going to raise your cholesterol and this and that. But as I read through the studies, I saw that, yeah, you can get like a rise in your LDL, the bad cholesterol. There is no bad cholesterol. Your body doesn't make poison, but, or your body doesn't poison itself. But then I saw that there was all these good outcomes, improved like sports performance, improved mental clarity, that they use the diet to treat intractable seizure conditions. A lot of times with medication, as it's the diet is like an adjuvant treatment or a helper treatment. Um, yeah, just the more things I read, and I kept waiting to see something bad, but I couldn't find anything bad. And that's when I came back to the gym and was like, hey, man, do it. Like, I can't find anything bad. And then you lost quite a bit, man.
Yeah, I think I lost like 70 pounds in
Hmm.
3 months
Yep.
doing that, and um, I do eat carbs now. But that was one of the things I wanted. You were explaining to me last night when someone ends up with so much body fat, eventually their body cannot absorb it anymore, so it needs to push that fat back out. And can you explain what causes the resistance to insulin?
Sure. So one of the best analogies that I've heard was if you imagine your cells as, well, that is what a room is. We call like a jail cell, right? A cell is like a little room with all these little organelles. And so when you're eating, let's say you're having carbs, you're having a really high carb meal. You eat it, the insulin gets secreted as soon as, okay, so as soon as you touch sugar to your tongue, you get an insulin response. Your body already is starting to prep for this incoming sugar.
And to clarify, carbs are sugar, like regardless of the source.
Exactly. That's another, man, we can go down the rabbit hole in
I
this.
know I go over that in the onboarding process that for our sake, all carbs get broken into glucose.
Yes,
And I think a lot of times people think of sugar as added sugar that's in like candy,
exactly.
but we're talking about fruit. We're talking about the small amount of carbs you get from veggies, the bread that you eat. So for our sake, carbs that touch that tongue, your body's getting ready for a sugar response.
Yes, your pancreas starts secreting insulin. So yeah, so just to reiterate, carbs are, of course, your table sugar. Any fruit, that's it's a carb. A lot of vegetables, bread, pasta, rice, beans, and a lot of times people, oh, beans are so good for you. Man, they'll spike your sugar up high. And I've had multiple diabetics that wear continuous glucose monitors tell me that they've looked when they've eaten like pinto beans or black beans, and they're, yeah, beans as well. So yeah. So as soon as you like that touches your tongue, you immediately, your pancreas secretes insulin into your bloodstream, and here we go. Your body will shut down all fat burning. You will not burn fat now. Just touching. So I could drop like 3 granules of sugar on my tongue right now and shut down all my body fat burning, which is crazy. There are some people, and I just was listening to a thing the other day, the smell of freaking like a cake baking can possibly trigger an insulin response. That's nuts.
So that sugar stops the body from wanting to burn fat.
Absolutely stops it.
I have a couple follow up questions here
Sure.
because, like, I have athletes sometimes they come in and they're like, I feel like I have no energy when I'm working out,
Mm-hmm.
and so I'll recommend eat a piece of fruit before you come
Mm-hmm.
because it gives them that glycogen storage.
Sure.
But if someone's goal is to burn body fat, how should they approach it?
This is where like a ketogenic diet, you can't top it, man. So you would want to, if okay, so if you're wanting to burn body fat, let's say we're not going down the keto rabbit hole, but if you wanted to burn body fat, you would want to exercise in a fasted state.
How far in advance should the fast start? How many hours before?
Ooh, so I mean, being real, I would say like 16 hours. I'm not saying insulin lasts that long, and being real, also, I can't tell you what the length of time for the mechanism or the action of insulin is.
And that's okay. That's one of
Uh,
the things that
I
we're
don't know.
we're big fans of is if we don't know, we can be honest and say
Yeah,
we don't know. But
I
I
won't tell any
knowing
fibbies.
knowing you, you're probably going to go figure it out.
Oh yeah, I'm
You're
I'm
going to leave
now
it
like
today
curious. Yes,
because that's a good question. Like if we ate breakfast and we work out at
that
3,
is a
is
good
our
question.
insulin still pushing?
It shouldn't. I don't think it would. I would probably give it like maybe 4 or 5 hours, but yeah, definitely something to look up to try to figure out when that the action of insulin wears off so that your body will actually go back into liberation of your stored energy sources, which are glycogen, glucose, and your body fat making ketones.
So,
Oh,
and
and that's the other thing. For you to start burning body fat, you need to burn through all of your glycogen. Or, you hear about this zone 2 um, heart rate, and they say that is where you can talk, but it's uncomfortable. Not like almost impossible, but you're uncomfortably able to talk while doing whatever exercise you're doing. And they say that that puts your heart rate at the right place because a big part of like the heart, your heart only, it does not run on any glucose. Your heart runs on fat. So um, that's why a ketogenic diet is now being studied by the military for heart failure.
and we're going to get into type 3 diabetes in a little bit
Sure.
too, but so again, I want to clarify because I
Oh, I
work
know.
with a lot of type 2 diabetics.
Sure.
And
Okay.
so what is causing that
Insulin
A1C,
resistance.
that insulin resistance?
Okay. Yes. So imagine a room, and that room is a cell, one of the example cells in your body. And then let's say in the hallway, and you've got multiple rooms, and there's this hallway and it's full of balloons. Balloons are glucose. So insulin is the key that unlocks the door to this room. So here's the room. The only way to put the glucose, the balloons into the room is to take the insulin key, unlock that room, open the door, and push in the balloons. Okay,
Does it matter what type of cell, whether it's a muscle cell for glycogen or a fat cell?
so muscle cells have a particular type of transporter that with activity, it actually opens this channel, and it's the GLUT4 channel, which just with muscle activity, these channels open up, and blood sugar that's circulating in your or sugar that's circulating in your blood can just go freely go through those channels and enter your cells. So your active muscle does not need insulin to take up glucose. Your brain does not need insulin to take up glucose.
Okay. So to clarify, we were talking about fat cells
Hmm.
that need to be open with insulin.
Not no all cells
Okay.
to take in glucose. They need the insulin, except for active muscle
Okay.
and brain. There might be a couple extras, but those are the two that I'm aware of. So now we're putting in these balloons in this room. And let's say we just more balloons accumulate in the hall. You keep eating, you're overeating carbs, and you keep taking that insulin key and opening up and pushing the balloons in. Eventually, that room, that cell, will be completely jammed, slammed full of balloons, and you cannot fit any more balloons in there. I don't care how much insulin. You've got the insulin there. You're unlocking the door, but there's nowhere to put the balloons. There's nowhere to fit it. Now, except for this room, in the case of like our fat cells, it's like pliable. So you can fill it with balloons and it can start stretching and stretching. And that's where fat cells grow until they hit this certain just final point. It cannot handle, like it is so stretched. So then you have one thing that happens is you, you lose circulation because the cell becomes so big and it's pushing away. So initially, and it's hard to do this without a chalkboard. If you had a blood vessel, which is my finger, and you had a cell that was the size of my fist, you can cover quite a bit of the surface area of that cell. So,
Is that what causes like necrosis?
exactly. So, that's one of the things so as that cell gets big, now you've lost a lot of the surface area of the cell to the blood vessel ratio. So now you start getting some necrosis, and on top of it, stretching that cell wall, you start leaking fatty acids. And this is where kind of like the paradox happens, and we see this in metabolic syndrome, type 2 diabetics, is we have like insulin should drive all the glucose in, and the fatty acids should not be getting liberated. Remember, insulin tells your body not to burn any fuel sources. But when you go so far and you've stretched your fat cells so much that they're leaking fat cells, now even though insulin should drive that fat down, you have high glucose, you have high insulin, and you have high fat. That's not what you normally should see ever. So this is where we start looking at like metabolic syndrome and type 2 diabetes.
And so, what eventually causes the pancreas to stop producing?
So the pancreas does not stop producing the insulin. Your body just, it's the doors or the rooms are too full. So you're producing insulin, but there's nowhere to put it. There's nowhere to put the glucose.
So, and maybe this is my misunderstanding. I thought that the pancreas kind of slow down or stop producing insulin, and then type 2 diabetics have to give themselves insulin.
Yeah. No. They that is this is why type 1 and type 2 I don't know. And I've heard some different metabolic doctors talk about this where they're saying it was a big mistake to put those two in the same category. Type 1 diabetes is when your body does not produce any insulin. Typically a child, they used to call it childhood diabetes because you didn't see kids with type 2 back then. Now you do a lot. But you would get like a virus or something, you would create antibodies to the virus, but that virus would resemble the cells of your pancreas, and then your own immune system would attack your own pancreas and kill it, and so that it can't produce any more insulin, and that's why they are insulin dependent diabetics. Type 2 diabetes, your body's producing insulin. It just cannot produce enough insulin to overcome the jam-packed cells they're already too full. And that's where the insulin resistance comes from. And so this is where I feel like the approach is not that great with what we're currently doing, where it doesn't matter if it's type 1 or type 2 diabetic, just put them on some insulin. That'll lower the blood sugar. There's no thought to, hey, what's actually driving this problem? Let's correct the driver. Or a lot of patients, like I've seen, they don't want to change it. They want to continue to eat and live the way that they're living and eating and just, yeah, sure, I'll give myself a shot. That's fine.
Man, do you know what the percentage is of outliers? So I call them outliers whenever I give my talk because I talk about hyperinsulinemia
Mm-hmm.
and then I talk about the what do we call it? The deadly quartet of cancer, diabetes,
Mm-hmm.
hypertension, heart disease.
Mm-hmm.
And I say most of this is caused by over consuming carbs and you're not
Mm-hmm.
producing enough energy to burn. And then I say, however, there are outliers, people who are susceptible and will get this regardless of what they're doing. So the US, we have a 76% obesity rating. What
Yeah.
percentage of that 70% is caused from they just cannot put down the donut and the cupcake?
Yeah.
Do you guys have a study? Like, is there any studies on that? On how many, what is the small, like we talked about, you would see type 1 diabetes in children
Yeah.
before,
Yes.
and you would never see type 2 diabetes in children, or
Exactly.
very, very small. Now, we're now seeing type 2 diabetes in children. And the only difference is the American diet.
Yep.
We started eating processed foods. And,
Yep.
I have a member, he talks about his dad, like they would, they had a cellar where they stored their meat back in the day.
Mm-hmm.
People lived off of homegrown foods for
Exactly.
years. And then whenever we had grocery stores and we started creating these boxed and processed foods, this is when the health of America started going down and rapidly.
Yeah.
So, but I hope that question makes sense. Like, what is the percentage of outliers that we could see that the kids who just happen to end up with type 1 diabetes
Mm-hmm.
or the person who ran marathons their whole life, ate a high protein diet, and
Mm-hmm.
then ended up with cancer? Like, do we have a percentage on that?
I There probably is, but I'm not sure. And then there's also like with if you did a study like that, it would be hard to eliminate all the extra factors that can happen. So like just your environment, you know, because now we're starting to learn more and more. And I'll say a lot of the diseases of today, especially the chronic ones, they're basically now, I mean, at least the people that I'm listening to, they're starting to consider all these mitochondrial diseases. So your mitochondria is originally what we probably learned in, high school or whenever you did biology, the mighty mitochondria, powerhouse of the cell. We just thought of it as, oh, this thing that runs the electron transport chain to make energy, to make ATP. But they are starting to do a bunch of new studies and they are finding that the mitochondria actually causes genetic expression. So we used to think of the nucleus as like the the main guy in the cell, but what we're learning is like the whole anti-aging thing is based around mitochondria. Diabetes, mitochondrial disease. Cancer, mitochondrial disease. All kinds of stuff. Dementia, mitochondrial disease. And this is when we talk about like, so it's kind of, it is becoming more complex than what we eat. But I will say, I got lost in on what the question
It happens
was.
to me all the time. I mean, we're going down like some very advanced things that I really hope my listeners can stop, process, and understand. Because so one of the things you talked about, you just said, is if you took biology back in the day, we thought it
Mm-hmm.
was this, and now medicine is seeing this. And something you and I have discussed, the food pyramid.
Yeah.
Like,
Oh my God.
bread was the base of the food pyramid
Ex-
forever. And then we're finding out, well, bread's what is causing most of these issues.
That's it.
It's what's causing the high insulin levels, and it's what's causing obesity, and it's what's
That's it.
eventually leading to diabetes. And can you, so type 1 is insulin dependent where the pancreas shuts off.
Yep.
They
It's
are
destroyed.
they have to give themselves insulin.
Yes.
Type 2 is their body cannot produce enough insulin,
To
and
compensate.
and
And
so
all the cells are slam full.
and that's
That's the
why
problem.
and so that's why whenever we adjust their diet, we typically get people off of their medication within 4 to 6 weeks.
That's it, man.
And
And
that's all it takes is 4 to 6 weeks of clean eating and
that's
your
it.
insulin matches what you need.
That's right. And the cells get emptied out because you start the fat loss and you get all that stored crap burned out. And now there's room for glucose. So when there's the balloons in the hallway and you have your insulin key and you open the door, there's plenty of room for it. Weight loss, man. Metabolic health and building muscle because
And this is what's hard for me in my career is I'm a CrossFit trainer.
mhm,
I'm a certified CrossFit trainer, but people look at me as a CrossFit trainer.
yeah,
They don't look at me as a doctor and they'll say, well, my doctor said this.
sure.
Sometimes it upsets me because I have the better path than your doctor. And you and I discussed this. Doctors get, when you see 100 patients
Hmm.
and 99 of them say, no, I'm not going to do this, they quit trying.
Yeah.
I mean, I remember when you were working, was it Dr. Hess?
Shadowing Dr. Huss. Yeah.
Yeah, and you would give people these diet recommendations, and you said eventually you become numb to trying to provide this to them. So it turns into it's easier to say,
Sure.
here's the pill, here's the shot.
Sure. That's
And
what you want.
so, and
Yep.
that's what doctors. There's a saying for it. Not immune. What's the word I'm looking for?
Numb. Or I know what you're
Like
saying.
yeah, like
Yeah.
you become numb to it. Like I have a nurse. She's a nurse and works in the OR with
Hmm.
brain and spine surgeries.
Oh boy.
So she sees brains and spines twice a week.
Yep.
You become numb to
Yep.
injuries. Like
Yeah.
people break an arm, you're like, oh,
Oh.
that's nothing.
Yep.
I've seen this for 30 years.
Yep.
And so we're not approaching it as an individual human on every interaction.
That's right.
And so, man, I wish you and I have discussed this. Like, if we were able to take away that medication, I'm aware that some people do need it, but if we
Yep.
were able to say, no,
Yep.
you have 1 year, you have to change your diet before, and you're going to suffer a whole lot more if you do not change your diet in this year. So you have an option. You can
Yep.
either change your diet, you have 1 year, and then I'll give you the medication if you truly need it,
Hmm.
or we'll see how this goes. So, because it really is that simple.
It,
It's really as simple as don't go down the aisles in the grocery store because that's where all the processed food is.
yep.
Stick to the perimeter, eat meats,
Yep.
keep your carb intake to your energy output.
Yep.
And that's how simple it is.
That's all you have to do, really.
But
It,
people get overwhelmed with nutrition, and
of course, 'cause
things
we
do
keep
not have
hearing
to.
these different
Well,
things.
I get all the time. Do you have any meal prep ideas? Do you have any meal ideas?
Oh yeah.
Cook a
Oh,
steak.
people
Like
ask you.
that's my answer. Like I don't do
Yep.
anything fancy. I cook a pound
Exactly.
of ground beef and I eat a pound of ground beef.
That's exactly it, man.
You know, it does not it tastes good on its own. I
Yes.
don't have to spice it up for me to intake it.
That's right.
But the issue is people have been living off of sugar
Oh yeah.
for 20 years and so they're used to that drug.
Big flavor, and it is a drug, and they've done studies, and sugar causes the same amount of dopamine, which is what makes people addicted, as cocaine. Like it is straight up a drug. And
Do you remember my Reese's cup addiction?
I do remember you eating.
You remember
Yeah.
like I would eat 4 or 6 of
Yes.
that, or we'd
Yeah.
go out to eat afterwards and I would eat like 2 or 3 desserts.
It's yes. It's so easy to get
And then I
locked
wonder
into
why
it.
I balloon up again.
Yeah,
But,
exactly.
it, like I don't go into gas stations anymore
Oh yeah.
because if I see that white chocolate Reese's egg,
Yeah.
it's like my brain goes into panic mode and I'm like, God, I can have one. I can
Yeah.
just have one. And then all of a sudden
Exactly.
it turns into I'm stopping and getting 4 a day.
Oh yeah.
And so if people, we also live in a time, I'm going on all these crazy rants because my mission, what I do every single day, I wake up at 4 a.m., I go sit in that office and I start thinking of how can I improve the lives of people in West Virginia.
Hmm.
That's like all I think about every day
Hmm.
is how do I improve the lives? And I see so many people reach out to me who have type 2 diabetes. They're 200 pounds overweight and they want to make a change, but they don't know where to start. And I'm
Hmm.
like, all you got to do is come in and talk to me.
Sure.
And I will change your
Exactly.
life. If you listen to what I say, Jeff Josie used to say it. If you move the way I tell you to move, if you eat the way I tell you to eat, and you create good human connections,
Hmm.
I can change your life.
Yes.
And too many times people will not take the plunge.
Yeah.
But we live in a time where you can do grocery pickup. Like,
Oh yeah. Well,
You don't
and
even have to go into the grocery store now. You can set up to where you have all that food. It gets brought out
yeah,
to your car. You no longer have to worry about being pulled into the aisles and grabbing the Pop Tarts or
yeah,
the cereal, all that extra junk that we don't need.
yeah.
And you can truly make a difference in your life by improving what you're putting into your body.
Yes, 1 million. I mean,
And
we are what we like. They always say you are what you eat. You are what you eat, and you burn what you eat. And so, all of our cells, like cells, get replaced constantly. And if you're like eating trash, man, the cell walls, the flexibility, and this also goes, man. Seed oils are trash, man. Canola oil, sunflower oil, any of these like nut and seed oils are really trash.
if I cook in butter, my cholesterol not going to go up?
Oh my God. No, I know. No, I eat nothing but butter, lard, and beef tallow. That's it, man.
Yeah, I want you to explain because I heard you talking to your friend last week about the LDL and what happens in the liver and why it's actually okay. But
Sure.
I just had another thought. One thing we just did your in-body scan
Yeah.
and you were 11% body fat
Yep.
and you work out every single day.
Yep.
You do jujitsu, what, two,
Twice, 3 times a week.
3 times a week.
Yep.
So you are fairly active and you're eating what is it 20 carbs a day? Like
Less than 20 or
less
less. Yep.
20 or less. You've been doing that for years. So where is your body getting the energy? Because we're a CrossFit gym. We are high intensity and
Sure.
um they talk about like the keto flu or like when you're trying to change that energy.
Yep.
Do you ever like burn out or what is giving you all that energy?
The,
Will your output slow down? I'm trying to figure out what.
Yeah, no, not at all. One, of course, like you've got not only the fat, the subcutaneous or under the skin fat, but you've got visceral fat, and that's fat that surrounds your organs. But now I'm going to give you a real brain bender. I'm about a 70 kilogram man, but my body every day produces like 80 kilograms of ATP.
Well,
Where
you're
does that coming from? Where does that come from?
70 kilos is about 170 pounds
Yeah.
for the American listeners.
Yes.
Um,
Which is bananas.
so
Our body,
what? Sorry,
sure.
what is restoring your glycogen?
I'm running on ketones essentially. But here it is. Our liver can make glucose. So it's not like my blood doesn't have any glucose in it. And I'm going to also say we've got different types of sugar. So we do have glucose, which is what our blood sugar uh, tends to be. Then there is fructose, which is the fruit sugar, which is metabolized differently. And then you have like lactose, which is milk sugar. So glucose is the okay guy, and it's not very sweet. Fructose is sweet as heck. And and like I said, and it's also metabolized differently. So fructose, so basically you could drink pure glucose and it probably wouldn't be that sweet and it wouldn't, I mean, you would definitely raise your blood sugar, but you drink a glass of fructose, it goes right to your liver, the same as taking a drink like an alcoholic drink. So drinking a glass of orange juice is literally doing the same damage to your liver as drinking alcohol. It's it's unbelievable. So you can take a
So
glass of orange juice or a shot. Either one. Which one's more fun?
it's just great. And then you remember back in the day, it was you had your cereal with your glass of OJ.
Exactly.
And it
Exactly.
just and that OJ was concentrated, so they
Yes.
added additional sugars to it.
Yes.
So when I ask about the glycogen,
Hmm.
when we talk about the glycolytic or the anaerobic pathway,
Sure.
what's giving you energy inside of that metabolic pathway on the keto diet?
So my liver your liver, everybody's liver should be able to take amino acids, switch them around, and turn them into glucose for the cells that need. We've got just a couple types of cells that need glucose, period. Like red blood cell does not have mitochondria in it. It needs glucose. I think that might be about the only cell in the body that just plainly needs. Check me on it. I'm not saying that I know for sure, but it's only a couple cells. Um, so basically, there's that little bit of blood sugar that's running the necessary things that my liver is producing from protein. And then my liver is liberating ketones from the stored fat, and basically everything else is running on ketones,
So with CrossFit being high intensity, we typically live in the glycolytic pathway.
man.
That's the majority of our workouts is the glycolytic pathway. Would you say that your body just takes time to adapt to
Yeah,
where you can find the energy for that?
absolutely. And like, so, like, doing, again, I've done keto for like 10 years, dead straight, but I've been doing intermittent fasting for the last 5 years. So I only eat once a day, and I've been like that for the last 5 years.
I think it's important to say though, because we were covering how much you eat, 5 eggs and then 2 pounds of meat.
Yep.
And so you're getting close to 200 grams of protein at that point.
Oh, yeah.
And so
Some
oftentimes,
of that gets transformed by the liver into that glucose.
yeah, gluconeogenesis, if
Exactly,
anybody wants to
brother.
look it up.
Yes,
So
exactly.
and you got gluconeogenesis is where your body takes the protein, turns it into glucose to be used for energy.
Exactly.
So one when we start someone, we have three phases of nutrition.
hmm
One is using the plate method to get them to eat quality foods.
hmm
Two is getting them into quantities by looking at protein and calories.
hmm
And we say that protein is the priority,
Yes,
not the calorie intake. I
exactly.
want you to hit your protein goal. And when you're 175 pounds, but you're eating 200 grams of protein a day,
Mhm.
your body's get enough to repair this. Oftentimes, people think of protein as only repairing muscle cells,
Yeah, no.
and they don't realize that it's responsible for repairing multiple cells.
Oh yeah, your collagen, which is like your tendons and all that. Yeah, and it covers like it's the articular surface of joints. No, it's and like the, let's even just for another example of, we think of collagen, oh, like nice elastic skin, collagen, elastin, this and that, and it's holding our muscles to our bones, anchoring our muscles to bones. But then you have like intraocular collagen. Our eye has this one type special collagen that slows the light down as it enters the eye. I mean,
Do you know what type 1 and type 3 collagen is responsible for?
yeah, that we used to have this way that we remembered it. I want to say, I don't remember. No, bone. B1, I think, is how we remembered type 1. Type 3, maybe skin and something else, tendons. I don't remember.
It's funny you say that because I talk about collagen almost every day in
Dude,
here,
collagen's so
and I
important.
didn't ask you to say it,
No,
but I talk about how important it is for tendon and ligament
you
health.
better believe it. And that's protein, baby.
And yeah,
Protein.
ours has 15 grams per scoop. We carry first form, but I do 2 scoops a day, so I take in 30
I'm
grams.
constantly drinking collagen, brother.
And
Like all day
I
long,
try
I'm
to tell
drinking it.
people. So for you guys that
Yep.
have heard my
I didn't
story,
even know you're into collagen.
yeah. So the story I
Yeah.
give in onboarding, I have two different stories. I have a coach who tore both Achilles. First one took 6 months to heal. Second
Yikes.
one took 6 weeks.
Yeah.
Was on collagen for the second
Oh,
one.
shoot.
My other story is myself. I
Yeah.
have two torn labrums in my shoulders,
Yep.
and I always say I got hip tossed by this guy in jiu-jitsu, and it was you.
That's it,
And I
baby.
mean,
Yeah.
you remember that was a hard
I
throw.
remember it, brother.
And
Yes.
you remember like I couldn't raise my arm over my head.
I remember, man.
I couldn't
I
do a
felt
lot of
horrible.
stuff after that.
Yeah.
I started taking collagen. I have zero shoulder pain now.
Yeah, brother.
No surgeries. Do you remember like you ended up
Hydrolyzed.
you
Always got to be hydrolyzed collagen.
well you referred me to
The guy
an
that did my
ortho
knee.
because my shoulder was so bad.
Yes.
I did a banded rehab program, started taking collagen, and I've had zero pain since. So I
Yep.
was able to avoid the surgery.
Yep.
And man, I wish more people would look into it and
Oh,
start
yeah.
taking it. Because what do we lose? A percent of our production after the age of 30 per year?
Oh, I don't know, but yeah. No, absolutely.
Like you're
Everything starts like going downhill. Like your kidneys will lose 1% per year, I'm pretty sure. After 30, then like 31, you've lost 1% function. 32, now you've lost 2% function. 33, 3%. I'm pretty sure that's the rule. But it is a constant like that. Unless you do some like damage, you're taking a bunch of NSAIDs. If you're eating ibuprofen and all that every day, you're going to do some kidney damage. They're not going to function at all. And then if you go the other route, which is, so you can either do ibuprofen, kills your kidneys, or let's do Tylenol, kills your liver. or you can do turmeric and collagen and like preventative
And
body care.
I take omega threes.
I take omega 3s like crazy, DHA and EPA, man. Yes.
Yeah, we do. We
I
recommend three
double what
grams a
they
day.
say. Yeah, I double what the bottle says. Yeah,
I
I take
do.
monsters.
If I have like an acute injury and I have inflammation, I double my fish oil intake.
Yep.
Rather than taking NSAIDs, I double my fish
Oh
oil
yeah.
intake.
And you can do turmeric again also with the curcumin.
I think it's in our micro factor that we carry,
Cool.
but
Yeah,
it's
super important.
it's great to hear a doctor
Oh
talk
yeah.
about and we did not discuss any of this beforehand.
Absolutely
I
not.
told you I wanted to talk about type 2 and type 3
That's it.
diabetes,
Yep.
and you are one of the what is it the most health conscious you're one of the most health conscious people I know.
Well, thank you.
You know, it's hard to we talked about this before. It's hard to trust a doctor when you go in and their face is purple because their blood pressure is up and they're like, "We need to get your blood pressure under
Yeah,
control." And I just want to ask, what about yours? You
exactly.
know, so I'm more likely to trust a doctor whenever I come in and they're 11% body fat. They work out every day. They eat right, and they're taking the correct supplements for their
Yes.
body to. I think we didn't even discuss. People can see the video. You're 45 years old.
Yep.
You're 45, and working out every day,
Oh yeah.
doing jujitsu still 3 days a week,
Yep.
and
Rock climb back in like a couple of years ago on a constant basis.
yeah, I mean,
Yeah.
I see some people now who are 30 and they're not able to move.
Yep.
So we hit type 1, we hit type 2. Now, the new thing, type 3. And
Yes.
I've been trying to start looking into this stuff because we talk a lot about insulin and glucose in our onboarding.
Mm-hmm.
Can we discuss what are they seeing with insulin responses that's causing the memory loss with type 3 diabetes?
Mm-hmm. So yeah, they're starting to now call dementia type 3 diabetes, and Alzheimer's falls into that category. And type 2.5 diabetes is PCOS, polycystic ovarian syndrome. That's another one. And I see a lot of young girls that, I mean, they're developing, yeah, polycystic ovarian syndrome, which is treated how? With diabetes drugs, or you can just treat it with diet. And then you have, yeah, type 3 diabetes, which is um, dementia, Alzheimer's, dementia.
So I can't remember if it was you. I might have been talking to another doctor,
Mhm.
but what they're seeing is I was talking to my therapist because he's the brain expert,
Mhm.
and
Yeah.
he was talking about he was reading a study where they were finding that basically when someone has dementia or Alzheimer's, the memory is still there.
Mhm.
The connective path to pull the memory,
Okay.
so you can so like you can visualize it, that path is broken.
Okay.
And he he wasn't deep into the study yet, but he was talking about like is insulin breaking that pathway or blocking that pathway from pulling the memory from its storage in the brain to where you can visualize it.
Mm-hmm.
And so, man, I hope that's making sense because whenever he was saying it,
Yeah.
I was like, well, that makes sense because we talk about insulin all the time when people are having too much insulin being put out. So, and when we talk about too much insulin,
Let's just talk about too much insulin for a second.
because if someone's pancreas is already producing the max and then we're putting more insulin
It's
into it,
crazy.
what is it doing to the brain? So,
Oh,
can you talk about what is causing that type 3 diabetes? What's causing the memory loss?
well, now that I can't, I have not looked that into the mechanism or that pathophysiology, but I did want to comment on the hyperinsulinemia. First of all, I want to say A1C. So, what is an A1? And this is how we, nowadays, this is how it used to be oral glucose tolerance, but now we diagnose diagnose diabetes with an A1C, which is a glycated hemoglobin. And so, what is glycation? That's when you have sugar that interacts with a protein and it kind of causes like a broken protein. And so you can measure because red blood cells stick around for about 3 months and then your body recycles those. So if you take a measure of the A1C, you're kind of getting an average of how much sugar those red blood cells have been exposed to in 3 months. But I'm going to tell you, that is not the best way to diagnose diabetes. A fasting insulin level is actually the best way to diagnose type 2 diabetes. And I'm going to start doing that with my own patients and stuff back in Georgia. I just need to figure out what type of a diagnosis code to put down so that the insurance will pay for it. But that can give you a leg up 10 years before somebody gets diabetes, a fasting insulin.
Wow.
So that's something to maybe ask your doc if you're curious.
And we discussed
Oh,
type 2 and 3 can be treated
yeah,
with
completely
diet.
with diet, period.
So, what about the
And one thing I do want to throw out about insulin, though, real quick, insulin is a growth factor. So we're seeing a bunch more cancer. We're seeing, so like, you've got this, you're eating like this, which is making your body crank out all this growth factor. And then people are like, wonder why all these tumors are happening. It's like, yeah, that's why they're starting to say cancer is not a genetic disease. They're starting to say that cancer is a metabolic disease. And so it really comes, it all kind of breaks down to hyperinsulinemia is your problem. They're saying that that's what causes the kidney damage because when you have diabetes and you're cranking up the insulin and you have this insulin resistance, you're going to have kidney damage for sure. You're going to start off getting the CKD, chronic kidney disease 1, 2, 2A, 2B, 3A, 3B. You see it all the time, man. All these dialysis patients, they're 99% diabetics. So yeah, the hyperinsulinemia, it's causing so much damage. It's unbelievable. Um,
and it can be stopped with a diet.
with a diet, just cut the daggone carbs, man. Also, the hypertension, high blood pressure, it's insulin driven. It's glucose driven. I know that everybody's being told like, don't eat salt, don't eat salt. Salt's a bad guy. Not true, man. Your nerves run on salt. Your brain runs on salt. You go ahead and you cut out the salt and drink a bunch of plain water, no electrolytes, and you see how good you can think and how well you can perform and how much energy you have. And that's where keto flu comes from, is electrolyte. You're not eating enough salt. That is typically what causes the keto flu. They are not taking up enough electrolytes, salt. So, I mean, yeah,
It, we talk about,
it's all fixable with diet, though. You absolutely can
I know,
reverse type 2 diabetes. I've done it multiple times with diet. You don't even have to like do a big exercise
I
regimen.
know, and one
That's
of the
for
things
health.
that truly bothers me is when I'm working with someone who's overweight and they have overweight children.
Oh yeah.
Because
Yep.
listen, I'm a father. I got two little girls, and when they were born, it's like you got to do everything in your power to set the absolute best example
Yes.
on how to be a good human,
Absolutely.
and it's emotional and physical. So,
Yes.
and you provide them with tons of love, but then
Yep.
you also teach them how to take care of their body.
That's right. That's
And
right.
I don't know if parents are aware of what they are passing down to their children because
I
it's
don't think that they know.
obesity is not a genetic trait.
No, I don't
It's
care what that
it's
lady from Harvard said. What
it's
a joke.
it's the habits that we pass down.
That's right.
If your children are only fed mashed potatoes and fried pork
Yeah.
chops or
Macaroni and cheese.
macaroni, cheese, and cheeseburgers,
Yeah.
how are they supposed to learn? One of my biggest pet peeves. I know I'm going on these terrible rants right now,
Nah.
but one of my biggest pet peeves is like my mom.
Yeah.
Let me be a grandparent. I want to take them out for ice cream and stuff.
Hmm.
No,
Yep.
no,
That's
because
right,
what
man.
you're doing is you're tricking the brain to say this is your reward.
Exactly.
Poison is your reward.
Exactly.
And
Take him out for a beer then. Like, come on, man.
but
Yes, that's right.
I don't think parents realize, and people will say like, "Oh, let kids be kids."
Exactly.
So then, how are
Who
you
came up
supposed to
with this
tell
stuff
them?
for kids?
Well, how are we supposed to tell them, "Hey, at 18,
Yeah.
figure it
Time to
out.
stop.
Time to
Exactly.
stop. You're gonna have to figure it
Exactly.
out on your own. I know I've fed
Exactly.
you this way your entire life, but
Exactly.
I know you love having your Cheerios
That's
every
right.
morning. But now it's time to stop doing that because if you don't stop doing it, you're gonna end up with cancer."
Well, brother,
And
the heart disease, atherosclerosis, there it starts at like 3 and 4 years of age. So like you get like, parents feeding like their kids this stuff, and you are absolutely getting them started for heart disease, like from that age. And you don't have to be diabetic to be starting to develop. Although and on the cholesterol tip, type 2 diabetes is the number one risk factor for heart attacks and strokes. It is not elevated LDL. LDL is just cholesterol it's cholesterol is cholesterol. You have HDL, LDL, and you can subdivide those. And then you have triglycerides, which is another component. HDL is the good guy. Why? Because it's picking up certain things. LDL is the bad guy because it's taking cholesterol out in the bloodstream. So just because it's taking cholesterol out in the bloodstream, that cholesterol is to be delivered to cells because cholesterol is a component of the cell wall. Our brain is structurally made of cholesterol. Cholesterol is not a fat. It is considered a lipid, but it is a structural protein that's used, like I said, in our cell walls. If you cannot make cholesterol, you will die. Period, because there is genetic conditions for it.
So what causes blockage in arteries? Because isn't that something they think that like LDL builds up?
Yes, and so for this, I'm going to give the analogy of if I'm driving by a building that's on fire and and I'm not, let's say I'm an alien, might be anyway, and I'm looking at this building on fire and I see these red fire trucks in front and I see these guys out there. I might look because I'm just taking a snapshot. I might think, oh my gosh, those red trucks and those guys in those red trucks are starting fires. That is, I think, what's happened with cholesterol because cholesterol shows up at the scene of uh, arterial wall damage because it's a structural component. You need it to rebuild things, right? It's there at the scene, then it's been implicated as the cause of. But in my opinion, if you look at what glucose does, glucose that's floating around in your blood, if you have too high blood sugar, this is why diabetics need to get their feet checked all the time because the glucose will kill their nerves and then they get numb feet and then they don't know whenever they've hurt themselves. And then also all that glucose floating around in your blood feeds the bacteria. Now you get infections. Next thing you know, you're going to have to get something cut off because it's just necrotic, dead, rotten tissue. This is where the high glucose ruins the nerves in your eyes. So diabetics have to go to the ophthalmologist all the time, every year. And so it corrodes things. It causes inflammation. So when you have glucose floating around in your bloodstream, it is causing this inflammatory cascade. And also those insulin resistant fat cells. Remember when I told you they're getting so stretched that you can't put anything left? They are releasing inflammatory cytokines. So this is also driving the inflammatory process. So this insulin resistance and the glucose itself, you're just driving inflammation.
So
Sure.
is it the inflammation response that's causing the cholesterol to build up and cause the blockage? What's causing the cholesterol to stop
I
and build up?
so I don't think the cholesterol is stopping and building up. This is my opinion, and you can hear all kinds of different arguments about it. But I think that the high insulin is driving the blood pressure up. You get that high blood pressure, and it's causing a shear force against the blood vessel wall. This shear force is going to cause a little bit of damage. Now you start having places where you can have, especially if, and there's different subtypes of the LDL. You get the small, dense kind that can deposit in those little cracks and crevices, or just from that damage to the wall. You're going to have inflammation, which brings in your white blood cells to come kind of try to repair that. And then this is where the cholesterol comes in as a repair, a component, a structural component. Your LDL or your cholesterol that's floating around in your body blood cannot go into your brain. But cholesterol is so daggone important. Your brain has its own cholesterol manufacturing center, machinery, whatever you want to call it. Your brain makes its own cholesterol because there's a huge uh, portion of your brain that is made of cholesterol.
So you're saying your opinion is the cholesterol's not actually building up, it's other things building up, which
Correct.
honestly
It's the inflammation.
I'm not a doctor, but it would make sense if we have too much glucose in there and we have too much insulin in there, and
hmm
then
It's driving this inflammation. It's causing damage. And because cholesterol is like I said, it's a structural component. Just think of cholesterol as a brick. Cholesterol to a cell is a brick to a building. It's just a structural component. So, but we've demonized it because that goes back to the 1950s when this dude Ansel Keys was this researcher. Like the U.S. president at that time had a heart attack, and that's when the U.S. declared war on heart disease. And they paid this dude to figure out what was causing the heart disease. And Ansel Keys actually stole his idea from this German, I don't know what the German, some kind of scientist or physician or something. Um, and then even the German guy that came up with the theory in the first place later abandoned that idea. And I don't know what Ansel Keys, I don't know if he did or not. Either way, that is 1950s medical technology, this whole cholesterol crap. And we can talk about statins too, because I
Well,
hate those drugs.
I mean, we were talking about you were checking out your dad's 90.
Yep,
You were looking at his medication, and your dad's also a doctor,
yep,
and
pathologist.
he's stuck on that old school medicine.
Yes.
I think honestly, that's one of the things that has been nice about you getting your residency at this point in time is you are with the new studies. I
Hmm.
mean, if you would have got your residency when you got out of med school,
Yeah.
you would have been in that old school
Well,
place.
it's also partially like I'll tell you, a lot of my co-residents don't agree with me for a lot of stuff. There's going to be a lot of doctors, if they would listen to this, they'd be like, "That's bull crap." Um, but like, because I tend to look out for this kind of information. When I see it, I'm like, "Oh, check it out now. That's something that you don't hear every day." Because it's just the same thing getting regurgitated over and over. It's still the cholesterol's bad. If your LDL's over 100, you need to be put on a statin. Man, like that is so outdated. And they've now done studies where they've done like coronary artery CT scans, and they've taken the Florida, I think it was like the Miami Heart Group, was this group of people. They age matched like people that were minimum 5 years doing a keto diet, keto or carnivore. Carnivore is just a subgroup of keto. They took like these subjects that I think you had to be over 42, and then matched them with these like good, what the American Medical Association would consider eating a good diet, and they checked their cholesterol, and they saw like the keto people had a, of course, higher LDL, not, and so did some of these guys, but either way, then they did coronary artery CT on these people, and they saw the keto group with their high cholesterol, and some people's cholesterol was like up in their LDL only was like up in the 500s, and they saw the exact same kind of coronary artery blockage. By the way, you can get a coronary CT scan.
Have you had one done?
No, but I have a patient, the first patient I've ever had, that came in and we talked about it a little bit, and he's like, "Yeah, I'll do that," because I think he had that FSA fund through his work, so he could use it for that.
Mhm.
But most of the time, you're going to have to pay out of pocket. I think it's maybe like $400, something like that.
I think it would be interesting because
I would like to.
you said your LDL was 230,
Yep.
right?
Yep.
And so I think it would be interesting for you to have something like that and see, hey,
Yes. Yes. The only thing is, I've got some lifestyle risk factors in there too. I mean, I smoked for 30 years. So
yeah, how'd you quit?
how'd I quit? This guy right here, he got me to quit. But yeah, so and I was a heavy smoker, like 2 packs a day
I know
for quite
you'd
a
come
while.
in smelling like cigarettes for class, and
For
then
jujitsu,
we're walking out into the parking lot and you're
light
lighting
one
them
up.
up.
Yep.
But yeah, don't. It didn't take long whenever I was like, you know what, I'm gonna get him to quit.
By gosh, you got her there. Thank you, man.
Yeah.
Big difference. Big difference.
Um. So
But I
type
would.
1, type 2, type 3. Now,
Mhm.
can we talk about? And I really hope people make it to this part of this podcast because I am now seeing other CrossFit gyms who have athletes on Ozempic and they are
Yeah.
using their weight loss stories as testimonials. And
That's
man, it is
yeah, not
it is
cool.
hard for me as someone who is out to truly improve
Yeah.
someone's health to see them on this medication that has so many more risks.
Oh yeah.
And the only reason people want it is to lose weight.
Sure.
So, can we talk about the different medications that people use for diabetes? And we've already discussed that type 1, type 2, and type 3. type 2 and type 3 can be changed with a diet.
Absolutely. Reversed. You
Reverse,
can
like,
put it in remission is like I've got my patients that I've reversed in their note under that problem. I put in remission. Next line dash continue to monitor.
and so
Yes.
type 2, type 3, all we need to do is change our diet for 4 to
Yep.
6 weeks.
Yes.
But people will choose the medication over the lifestyle change. Let's talk about the side effects you personally as
Yes.
a doctor have seen
Yes.
from your patients.
Yes.
Because I mean, man, you were telling me this stuff, I was losing sleep over it.
Yeah.
The
Right.
idea that someone can go through something like this,
Yeah, dude.
all for weight loss,
Yes.
when I can change their life in 6 weeks.
Yes.
So hit me with the common side effects you have seen from these
Okay.
Ozempic shots.
Yep. People being admitted because of electrolyte disorders because they are not eating or drinking. People coming in with gastroparesis, which means your guts are paralyzed. Mood changes because you're paralyzing, your guts are your number one, your body's highest source of serotonin, which is the happy hormone. Easy way to think of it. Um, but you're paralyzing everything. So you're going to get dysfunction of the serotonin production along, and plus you're not taking in the nutrients to create this hormone. So you're having that. So you're having mood, gastroparesis again. I can name or I can say like 4 people that I've seen while doing like my emergency department rotations. That
That's you're allowed to talk about these stories. I'll cut it
I'm
out
just
if you.
saying no.
Okay.
Should be. Yeah, I can just say like I've seen like yeah. I can just say how about this? I've seen multiple people while I've been in the emergency department come in and it's Ozempic induced uh, anorexia, man. They're not eating and their electrolytes are jacked. They have to get fluids and they get admitted sometimes. I've taken care of patients inpatient where they're in the hospital and like I go in and it's like, yeah, well, I look and see what brought them in and it's because they cannot stop throwing up. But I can remember like they don't even know that they're going to throw up. That's the thing. Sometimes they're nauseous, like constantly nauseous, and that's also because of the drug. Because again, it paralyzes your guts. You eat a meal, and it's like the next day that your meal finally makes it through the gut digestion part
So when they have gut paralysis,
or stomach
are
digestion.
are they not absorbing nutrients?
Yeah, of course, it's going to
Is
slow that way down
so is it
because
also
it's not
like
transiting.
it's not pushing through the
That's
intestines?
right. It's taken a very, very long time.
So
This is where the Ozempic burps. This is a lovely one. Their burps are so rank because it's rotted food because that food is set in their stomach for like 24 hours.
and so that has to have acid in it. What is that
Oh,
acid doing to the esophagus?
well, if it's coming up, you're going to get GERD. But with these people, it's just like these. Well, if they're throwing up, yeah, you're going to start tearing up Jack. If you're throwing up on a regular basis, and this is where like GERD causes. It's a thing called Barrett's esophagus, which is where stomach acid starts like your body adapts. So the type of the lining of your esophagus will change to another type of cell whenever the stomach acid hits it on a regular basis, just as a way to adapt. Yes, you can have
S-
like
One of the things that I'll tell you what scared me for our population
mhm,
was when you said the gut paralysis. You have had patients where it is now permanent.
permanent.
So
Yes,
their body permanently cannot digest food.
can't pass food through. Yeah,
What does someone do at that point?
they got put on a pro motility drug, metoclopramide. And if you look into metoclopramide, it's got some lovely side effects.
Oh,
I didn't put them on it, but I don't know what the next step. That was a gastroenterologist that put them on that. Metoclopramide gives you your improves gut motility, but it can also give you extrapyramidal symptoms, which are uncontrollable skeletal muscle movement, tardive dyskinesia, some stuff like
so
that.
the other thing we see with Ozempic is people lose muscle mass.
Yes,
Is it also affecting their bone density?
oh, well, if you're not getting that nutrition, because basically what Ozempic does is makes you anorexic. You just quit eating. period. So you're not getting any nutrition, so you cannot. And when we talked about protein, collagen, all that, your bones, right? Your bones, they're protein, man. That's what, I mean, I know that there's like hydroxyapatite thing, but I'm saying a large amount of our bones is made of the collagen. That's protein. If you're not eating it, it's going to come from somewhere. If you're not eating calcium, your parathyroid hormone is going to go up so that your body can get calcium from your bones. So then your bones get stripped down for calcium.
Do you take a calcium supplement?
I take a lot of the supplements I take have a calcium, magnesium, zinc is
Okay.
one of them that I take.
S-
But I also eat like tons of cheese.
Well, we talk about like we're seeing someone's in their 50s,
Yeah,
right? And they're
yeah.
on Ozempic and they're losing all of a
Oh
sudden
man,
30 pounds of muscle.
Phew,
What's
not
going to
good.
happen when they hit 60s and they have a fall?
That's not good, man.
And
Yeah.
then
Oh
your
yeah.
body cannot repair itself
Yeah.
because you're missing the protein to repair.
Yeah.
You were telling you don't give any names, but you said you had a patient who was
Yeah.
in the donut hole where their medication was $2,000 a month,
Yep.
and you went through,
Just the diabetes medication.
yeah, and so you have handouts that you give to your patients on these are the foods I want you to eat. If
That's
you eat like this, you will be off of this medication within 4 weeks. You will no longer need that medication. And at the end of the day, that patient said, just write me the script. I'll find a way to come up with the $2,000.
yep. Yeah,
But
base
one of the things I said to you, and maybe you can use this moving forward.
sure.
Do you know what type of food you could eat on a
Yeah.
$2,000 a month budget?
Exactly, dude.
Like
No, you could
you could
eat
have ribeye
killer.
twice a day on
Exactly.
a $2,000 a month budget.
Yes. It's unbelievable to me. And yeah, I have my handouts which are from the Duke University Ketogenic Clinic. So I've bought their courses and they have courses for like ketogenic diet for cancer, ketogenic diet for type 2 diabetes control, ketogenic diet for type 1 disease control. Because if you have type 1 diabetes, you don't have to eat a bunch of carbs. You can eat low carb or keto and only have to use a teeny tiny bit of insulin. But but yeah, so I have those handouts that talks about the diet, what foods you can eat, what foods you can't eat. I sat down, was like, what do you think? All you have to do is do this, and you don't even have to spend any more money on medicine. And it was like, take the medicine. And I was like, okay, man, whatever, dude.
Is it
And I hadn't started them on it, like it, because as residents, we kind of,
is it hard for you as a doctor to so like I have members in here and man, I create an emotional connection to every single person who's walked through these doors.
sure,
If I see someone on the street, I can tell you their name, I can tell you their spouse's name, how many kids they got, what they do for work, and they
sure,
may not have been here in 5 years.
yeah,
But I wake up every day with the goal to improve the quality of life for every single person who steps through these doors.
yeah,
So when someone decides to leave,
hmm,
it I have a hard time. It's hard for me to cope with.
yeah,
And so when you want the absolute best for someone and they don't want it for themselves, I used to have a mentor and he would say, Devin, you can only care just a little bit more about their life than they do.
yeah,
And it's really hard because it's not I have the secret.
yeah. I know, dude.
Quality movement, quality
I
diet.
know,
That's the secret to.
I know, brother.
And so we talk about the four pillars of, well, the three pillars of happiness, but you've heard health, wealth, love, and happiness.
Sure,
When we look at health, health is quality movement, being able to move until you're 90,
yep,
and it comes from a good diet
yep,
and exercising 3 to 5 days a week.
yes, man, yes,
And so I have the key for health.
yes,
I don't have the key for wealth, but love comes from building deep relationships with people.
sure,
And, everyone talks about community with their gym, but from the first day someone joins, everyone is cheering them on.
yeah.
Everyone is pulling them in. They want to know more about them because they truly care.
That's cool, man.
And so like
Yeah,
that's
that
the
really
love side
matters.
of it. Like
Yes,
um but I believe if health comes at the beginning of that sentence, because without your health, it's hard to enjoy the other pieces of life.
exactly, man.
Do you remember when I came back from that trip and I was 240 pounds? Like,
Yeah,
it's hard to do anything.
yeah,
Like, jujitsu is intense.
Yeah.
So when you're overweight, like it's hard to enjoy anything. I remember looking at a flight of stairs and being like,
Yep. That's
I
gonna
don't
be
want to
rough.
climb that stair. But I don't think about anything I do on a daily basis now.
Yeah. Oh yeah.
You know, it's I don't I don't think about walking down that steep driveway to check the mail. I don't think
Exactly.
about like we're gonna go mountain biking on Saturday. I don't think about how hard that's going to be. I don't think about my girls each weigh 20 pounds. I pick them both up at the same time and I can carry them around. Like
Yep.
I don't think about that stuff anymore.
Exactly. Like whenever if I'm lucky enough to have a rotation where I get like a lunch break where I can hurry up and whip back to my apartment, I eat no lunch. I get back and I do my workout so that whenever I get home, I can go to jujitsu or come home and spend time with my girlfriend and like make dinner or, So yeah, no, I work out for lunch. That's what I eat.
I know, and
Yeah, man.
it is hard. Like,
That's all I think. And it's not like, oh, my work. No, it's like, hey, I got some time. I'm going to burn that workout out and then I'll have extra time whenever I get home.
well,
Cool.
you've always been an active person. Even like when you were in med school and you talked about you would jump rope for an hour at a
Yep.
time. Like you've
Yep.
always been dedicated to that. I have gone through the waves of being overweight
Hmm.
and it is mentally exhausting to want to start something new.
Oh, yeah.
And I was explaining to someone the other day, I shared this picture of me when I was 19 years old and I was overweight.
Hmm.
And and I say the only difference between who I was then and where I'm at now is the consistency of showing up.
Yes, brother. Consistency. That is the key, man. You can have a little bit of a bad day. And I'm not making excuses to have an excuse. Maybe mess up a little bit, this or that. Maybe, but like if you just keep showing up, then you're going to see the results. Or you can do a perfect week and it's like, heck yeah. And then like let it start dropping. You're not going to get the results. You
Mhm.
have to be consistent, man.
I used to have a
Period.
coach. He would say, if you keep trying, you can't fail.
Man, I agree.
You know,
It's just like jujitsu, brother. It feels like sometimes like, man, I'm
oh
just in the
yeah,
same place.
you know,
You just keep showing up.
we're both brown belts, and like if you're having a bad day and you get some D1 wrestler comes in
Oh
who's wearing
yeah.
a white belt and they happen to catch it, you're not like, I
Yeah.
got to take off this brown belt now. Like I'm no longer
Yeah,
this
that's right.
guy. But it's literally just consistency.
Yep.
Consistently try.
Yes.
Wake up every day with a plan. You're going to have off days.
Yes, of course.
It's
Exactly.
human nature.
That's right.
So
But just showing up, man.
I know we've been going for about an hour and a half.
Okay.
If you could give a 1 minute breakdown of, I don't even know where to begin. We've talked about so much,
We've
but
gone
but
all over the place.
basically it's quality foods
Yes.
in a diet that your energy in matches your energy out.
Mm-hmm. Yes.
It's that simple.
Yes.
What do people do if they have no idea where to start?
So I would say if you want to, I can give you, first off, do not follow this. Well, I won't say that. First, if you, I would say eating real food. What I always tell patients is let's get in a time machine or like just imagine like 300 years ago if you went to some, settler person's house and they invited you for dinner, what would they have? There would be no packaging. They would be something they grew or, found out in the forest and something they shot or some animal that they raised and butchered. That's it. So at least start there. But if you want to, like, I'm going to say for like maximum weight loss and all that, ketogenic diet. Good places to look are there's a guy, Dr. Eric Westman. He's the one that he's an internal medicine physician that runs the Duke Ketogenic Clinic. Another good one's Dr. Eric Berg. And I'm talking, this is all YouTube videos you can see how, and they'll explain. So Dr. Eric Westman, Dr. Eric Berg, Dr. Ken Berry. He's a carnivore guy. I love that dude. He's a Tennessee doc, family medicine. Dr. Sean Baker. He's a orthopedic surgeon, hardcore carnivore. Yeah, you can check out their YouTube videos and you'll get tons of information how to get that just to understand that.
For anyone who's at CrossFit Control, are there any CrossFit coaches that they could talk to?
I'll be honest, This cat right here, he's the one that got me. Again, I'm hardcore keto. He's the one that introduced me to keto. So he would be like an excellent dude because he's got more than 10 years experience. He's got more experience with it than I do.
Great podcast, high protein,
Yes.
calories in matches calories out.
That's it, man.
It's that simple.
And you cannot run away from a bad diet. That's a big one. People think that they can reward themselves because they worked out. Give me a break. Get your diet consistent. That's the foundation of it all. If you just have a consistent diet, man, that will go so far.
Yeah,
The-
you have no background in CrossFit at all,
no.
and we have a hierarchy of athletic development pyramid.
hmm
So the base is the most important. The
hmm
base of our pyramid is nutrition.
That is what it is, brother. That truly is it, man. You cannot outrun a bad diet. Period.
I really appreciate you sitting on in on this, especially with the medical perspective.
hmm
I think that people learned a ton of information from this, and hopefully they were able to digest it and understand.
Sure.
I think you broke it down in a really simple way that we all could understand.
I tried to, and I tried to hit it from different aspects.